Oh, the Center of Excellence is the place where expert team members meet to help deliver care to a patient. So the entire team is present at the clinic appointments, and the team can see people as a group or individually, so that all the different types of needs that a person with Huntington's or their family members might have can be addressed at that appointment. And so I think the key parts are the expertise and then the teamwork that's behind that. There's usually a neurologist, there's a social worker, genetic counselor, a psychologist or psychiatrist, a nurse or nurse practitioner. There could be physical, occupational, or speech therapy professionals there as well. It just depends on the center and how the operations run at that center. And there may be other individuals who are involved. Learners are also commonly present in the clinic, and I love how the person with HD and their family members welcome the learners so that the future physicians and physical therapists and social workers and other people in the healthcare team can learn from the patients about Huntington's and about what the challenges are, and then use that to inform their practice as they go forward. The Center of Excellence really enables the grant money that comes from the Center of Excellence enables us to have people present in the clinic as a team. So in the typical care, you would maybe see your neurologist or see your primary care doctor, and it would be sort of one-on-one. And then any other sorts of people that needed to be involved, you would have a different appointment with the physical therapist and a different one, maybe with a genetic counselor. And in the Center of Excellence, you can see all the providers at the same visit. Maybe you won't see each one of them every time, but they're available there. But the magic is that all the different team members work together from their various professional perspectives, and we can discuss how people are doing, discuss what we're hearing and learning, and put together a treatment plan that's part of that team effort. And I think that's really special, and I know that that makes a difference to the patients and families. Sometimes the visits last pretty long because there's a lot of people coming in and out, but I think the fact that you know that you can get all of your needs addressed at that appointment is really remarkable, because sometimes people have to travel a great distance, or it's stressful to come to the clinic, or other things that come up that make it difficult. Just knowing that that's your HD home, where the experts and people who care about you and know a lot about HD are there to help you. If you are a member of a family that's affected by Huntington's, if you're a person at risk or a person who's having symptoms, the people who care for you, your care partners and your care team and your loved ones, we are there to answer the phone, answer your emails, make an appointment, try to serve all those specific needs that you would have for Huntington's. And that includes the medical care, but it also includes counseling, education, outreach, advocacy, many different things that we can do because of the center's program. It wouldn't be possible in just usual care, but the center's program makes all of that possible. To access this wonderful care at the Centers of Excellence, please go to the HDSA website, because there's a link there to all the centers. They have contact information, they have information about location, and that's the first place to start. Reach out to the center itself, and often you can be told how to be seen, what sorts of things would happen with insurance, what the schedule is, what type of care do you need. Sometimes you just need a phone call. You just want to have someone to call. It doesn't need an appointment, but if you need care, that's what we're there for. We try to be as accessible as we possibly can. All the centers work very hard to create that accessibility. It won't be, oh, we'll see you in 6 months or something like that. We try to get people in just as quickly as we can to establish their care and establish their treatment plan. And then importantly, we do a lot of follow-up. If we refer someone for physical therapy, or if we start a new medication or something along those lines, we want to hear from people, how are you doing? And so we do follow-up appointments. Some of those appointments can be virtual, some of those appointments can be back in person. We love face-to-face care, that's always very wonderful, but telehealth has been extraordinary for the centers to be able to continue to maintain those links. And we pride ourselves on helping people through the entire course, from at-risk or pre-manifest. Some people want to do predictive testing, but once people are diagnosed, we want to help manage the care all the way through the course of disease, all the way to the advanced stages, and there's a role for the center in each one of those. So the accessibility is a key part of the center's mission, and one of the things that I love about the center's program. on the horizon for the centers, I wish that people would come in early. I wish that people would want to be seen if they're wondering if they have symptoms or if they might have symptoms as early as possible, because sometimes you feel it's frightening to come in, it's frightening to face HD and a possible diagnosis. But from my perspective, if we can start to help people as early as possible in their HD journey, we can make the course of their HD journey much, much better. We have the capacity to see people. I wish people would come in a bit sooner and reach out to us. And if people start doing that, we might need to have some more hours for our social worker. We might have to open up some more clinics. We will need more genetic counselors as we have these new therapies that are in the pipeline going forward. So we'll need to expand and grow, and we will be very busy, I think, in the Centers program for the next several decades delivering these new therapies, bringing people in, starting them on treatment, monitoring them. The centers are going to be very, very busy, and I think we can easily expand from the model that we're in right now to be able to deliver that care. It's going to take fundraising. It's going to take, expanding the mission of HDSA to help create that accessibility. But I've known HDSA for 27 years now and been part of it, and I know that we can do it.